As I said before, this is a program for participants, not spectators, because our republic demands it. So I've got another action item for you, something that actually has a very short turnaround, and it has to do with the World Health Organization and the Biden administration. And helping explain that for us, Chris Gacek joins me. Chris Gacek is Senior Fellow for Regulatory Studies here at the Family Research Council. Chris, thanks so much for joining us. The World Health Organization proposing new guidelines for pandemic preparedness. It's basically a global power grab being encouraged by the Biden administration, but there's a window of opportunity for Americans to speak into this because the Department of Health and Human Services has a comment period regarding this pandemic preparedness agreement. Tell us about it.
That was a perfect description, Tony, and it's good to be with you. The Department of Health and Human Services posted a notice about a month ago, and the window is closing for comments on the new this draft pandemic agreement. It's really a treaty. It's about 30 pages, but so it's a big document. There's a lot in it. I mean, it's very important is what I'm trying to say. The window closes on Monday, January 22nd at 5 p.m., and you need to send your comments in by email. And there's an email address. So FRC Action has put together an alert, and that information is available from us. So that's, the
okay.
Sorry, go ahead.
Yeah, well, I mean, anything having WHO attached to it is bad, but I want people to know how bad this really is. I mean, there is some outrageous provisions in this that you have uncovered as you've dug through it. Tell us about it. Well,
I can just say that the scope of the power grab going on here that's being proposed is so monumental. What essentially happens, or what they're calling for, is that all the nations that are going to be parties to it, and the Biden administration is one of those parties, and the United States will become a party to this agreement, will basically cede just enormous aspects of economic rights and powers over to the World Health Organization in terms of all sorts. I mean, you can't even imagine, supply chains, intellectual property, rights to surveillance of, genetic materials, and it goes so far and wide. And then included in all this is the creation of just some new massive, pandemic treaty enforcement bureaucracy that's going to have to be just enormous, because this agreement covers almost every aspect that you can imagine of any economy.
When you talk about this primarily pertains to pharmaceuticals, but one of the issues in here is it must provide an uninterrupted supply of trans hormones and surgeries. I mean, what is that doing in this? Well,
they're masters at sort of folding in every agenda that they have, right? So for example, they can, a guiding principle of the overarching document, it's right up at the top, is this term that the agreement is guided by equity. Well, equity is this sort of neo-Marxist social justice talking point. It's a framing device that really means socialism. And in this, they mean that there has to be recognition of all sorts of oppressed minorities. Within this terminology and in this sort of social justice neo-Marxist framework, you can fit any of these kinds of needs and wants. And
so what does that have to do with preparing for a pandemic?
Nothing. It has nothing to do with it.
It's about pushing a leftist agenda.
Absolutely, but they're going to use this. The threat of a pandemic is a vehicle for essentially an enormous, broad-ranging power grab that has nothing to do with pandemics.
And part of this, as I understand it, and correct me if I'm wrong, Chris, but I've read through it, is that it is where we have the redistribution of wealth here in this country, socialism. Mm-hmm. This takes it to a global level where the United States would be responsible for whatever we manufacture. We've got to give 20% of it away. We can't keep those treatments or PPE for ourselves. We've got to give it to other countries.
Well, right. This is all part of this sort of equitable notion, right? It's not fair for the United States to have all these, vaccines and drugs and things like this.
Which, by the way, we produce and we make it available to the rest of the world.
Right. But one of the things that they want to be able to do, these sort of power centers, this new secretariat that they're going to form, is that they want to be able to tell all the rich nations, all the nations that produce the drugs and the technology, that they're going to have to hand over their products to other places, right? And so you can imagine the corruption that's going to go on. I mean, it is so mind-boggling, the scale, the vision of power acquisition that they have and that they're using for this agreement is just breathtaking.
It is so outlandish that it's unbelievable. I mean, you can't. When you actually talk about this, it's like you're making it up because it's just so far-fetched, but it is actually real. It's on paper. They're pursuing it. In May, it will be here if it's not stopped by Congress. So we're working on getting Congress to stop it, but we can kind of gum up the wheels a little bit if we have lots of comments going into the government, because they have to process each of those comments. So folks, text the word WHO, that's WHO, WHO, to 67742. You'll get the link that Chris made reference to. It'll give you the instructions there, and you can file your comment. It'll help slow this process down as we try to kill it. It needs to go away. It needs to die. I mean, there's no fixing this. It's just bad.
No fixing.
Chris, thanks so much for digging into this and giving us an update.
You're welcome.